This study is just such a great example of why we really need to read critically the literature, especially when the headlines are so egregious or they seem to be saying something that's really important for policy. So the title of this article that we're reviewing today is called "The Value of Nurse Practitioner Inpatient Hospital Staffing." And it was published in the journal Medical Care, and that was released in October of 2021. So the objective read, "To determine whether the presence of more nurse practitioners produces better patient outcomes net of RN staffing." So in the abstract, they said, having more NPs in the hospital has favorable effects and it adds value to labor resources. They randomly surveyed nurses and they got the nurses off of the state license lists. And they mentioned that, first of all, they didn't even know that these nurses even worked for the hospitals. They had to go back, I guess, and retroactively figure out. They asked the nurses if they worked for a particular hospital, and then they apparently went back and somehow manipulated the data.
They literally had to pay nurses to complete this study. And I think part of why they did that is because they wanted to reach that percentage. That this means that it represents the larger body better.
The main way that they obtained their data, everything was based on one number, the ratio of nurse practitioners to hospital beds. And the way they obtained that was by asking these nurses who answered the survey to estimate the number of nurse practitioners working at their hospital.
I don't think they ever intended to actually get a better measure of how many MPs were in the hospital. I think the survey data of these RNs essentially guesstimating was all that they planned on doing. I mean, they at least admitted that it was kind of arbitrary and crude. They kind of breeze over that real quick in one sentence. Whereas, like, at the core of this is nurses guessing how many NPs are in their hospital.
Yeah, these are registered nurses that are just hospital employees. That's like if you said to me, "Hey, you're credentialed at your local hospital. How many doctors do you think work at that hospital?" And me being like, I don't know, maybe like 100, and maybe there's 500. Like, I'm just guessing. I have no idea. And you're just going to take my guess and you're going to base a study around it. Am I crazy, or is this just, how did this get published?
That's really the problem. Like, we almost could stop here and just say, look at that study design. We know how bad people are at estimating, big things like that. And I couldn't guess how many NPs per 100 beds there are in the hospital I work at.
Well, the other thing they asked the nurses was to self-report the outcomes, meaning they asked them things like, do you think your hospital is very good? Would you recommend your hospital to someone else? How do you feel the administration responds? And how do you feel patients do? It was very, very subjective. These are perceptions that people have, and there's really no facts to base these feelings on. They may be true, but they may be completely untrue, and we don't know, and we have nothing to compare this against. Ultimately, they claimed that the nurses that said that they had more nurse practitioners at their hospital rated that facility more highly. And then they went back and they, I guess, cross-matched facilities with more nurse practitioners, according to nurses' estimates, as matching to having lower mortality, shorter average length of stay, lower costs. Let's go back to the lead author, who is Linda Aiken. She's a PhD with the Center for Health Outcomes and Policy Research.
So that's one of the things that I kind of highlighted. Everyone there is a PhD or NP, and there's a DNP. There's nothing wrong with that. But all of the funding sources were from nursing colleges at universities or the Robert Woods Foundation that have historically kind of pushed for more nursing practice rights and things like that.
The conclusion of the study, taking it back to our journal club, having more NPs in hospitals has favorable effects on patients, staff nurse satisfaction, and efficiency. NPs add value to existing labor resources.
That makes sense, right? I mean, adding more NPs, more staff to existing physician and RN professional care improves outcomes. That I can believe. The part that I have issue with is their discussion section, how they say that their findings are relevant to policy debates about NP scope of practice and unsupervised nurse practitioner practice.
They made their conclusion that NPs have value. And then the discussion was essentially that there's these autonomous practice agreements, these collaborative agreements in states, and that we shouldn't have these, essentially was the takeaway. All 4 states that they did this in were in states that if you go to the AANP site, they don't consider it full practice authority for NPs. They sent this survey out to thousands of RNs across all sorts of states. And they could have easily done this in states where they actually have full autonomy if they wanted to actually test if they work in that setting, but they didn't.
So what you're saying here is that, yes, the study shows that having NPs, and this is something we always say in PPP, NPs and PAs have value. They're important. They're important members of the healthcare team. But what the study does not say is that replacing physicians with acute care nurse practitioners in an inpatient setting is going to give patients those same outcomes or create all these benefits that they are kind of leading us to believe could happen based on this estimating study.